You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Kathy Biasi.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm your host, Kathy Biasi, and I'm an holistic nutritionist and a professional cancer coach. On today's show, we are talking about our oral biome with my guest, Dr. Derek Gatta. Dr. Gatta is a dentist, and he is the co-founder of RiseWell, an all-natural, science-backed oral care brand that is revolutionizing the industry with its dentist-formulated, non-toxic products. Derek is dedicated to promoting a healthy lifestyle, and he believes that optimal oral health is vital to achieving this. Together with his sister, Kori Estrada, and John Estrada, Derek embarked on a mission to help them create safe and effective alternatives to traditional oral care products after realizing that most of the products on the market were toxic. As the head of the scientific council for RiseWell, Derek leads the brand in searching for the healthiest, cleanest ingredients and raising industry standards for quality and purity. Formerly in the Navy, where he studied dentistry while on active duty scholarship, Derek attended Vanderbilt University and Nova Southeastern University for dental school, with a residency in Prosthodontics. He is passionate about educating people on how to achieve optimal oral health and currently runs a busy practice in Boca Raton. The oral biome is one of the things I go to first, that and the gut microbiome, when I'm working with my own clients in trying to achieve the best overall health. So this show is, another step in elucidating the importance of the oral biome and how everything is so interconnected. So we discuss on this show what the oral biome is, how our oral biome impacts not only our mouth health, but our overall health, and what the functions of saliva are, what saliva does to promote mouth health, what it does as far as impacting gum health, teeth health, and again, relating this to our overall health. Stay tuned. We will be back in just a few minutes to talk with Dr. Gatta.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Kathy Biasi.
Welcome back to the Health Hub, everybody. Today's show has been recorded. No opportunity for calling in. Please do follow us on our social sites. We are on Instagram, Twitter, and Facebook, and we are at the Health Hub RMC on all locations. Dr. Gatta, welcome to our show.
Thank you. Pleasure to be here.
It's, the speak about oral biome now and the health of the mouth. I had a guest on last week, and we were actually talking about liver health, and it ended up, we had a little bit of a conversation about oral health. So it is so impactful now. And I just want to thank you ahead of time for taking the time and really helping us to elucidate and get to the bottom about why this is so important for our overall health.
Hey, my pleasure. I think you make a lot of good points in the intro. And yeah, the link between oral health and systemic health, it's the new frontier of healthcare, and I'm excited to be a part of it.
Right? Like, and it just links up so nicely with it's a flow from the gut microbiome, the skin microbiome, the oral. Now, have you always been, I would call it an integrative practitioner. Have you always been this way, or do you label yourself something differently?
I have not. I come from a pretty traditional background. I applaud most dental educational institutions. They do their best to churn out competent, high-achieving dentists. But look, in academia, sometimes the information is slow to trickle down, and
Hmm.
I really didn't get access to some of this information in dental school. It really was kind of a search later in life. I'm a co-founder of a company, and also through some of these adventures and trying to bring products to market, my sister and brother-in-law and I were trying to educate ourselves and become more competent about information that's out there. What are other countries doing overseas that we may be lagging behind in? And it was really kind of a second pursuit to kind of achieve and continue to further educate myself that I kind of became more integrative in practicing dental medicine.
I've had a couple of medical professionals, MDs, on the show, and kind of a theme that I feel running through now is that those who are interested in the medical field about getting into and incorporating more of an integrative lifestyle, holistic approach to their practice, they're not waiting for the studies anymore. They're going out and they're doing observational things. They are looking at other, like you said, at other places in the world and trying to educate themselves along that piece. Do you see a trend in that in the medical profession?
Yeah, I do. You make a good point, and I do see a trend in that. And again, I might be a little bit more conservative to compare to some of my colleagues. I don't necessarily want to be on the bleeding edge of some of
Mm-hmm.
the new trends that are out there. I definitely want to make sure that what I'm practicing and preaching to my patient base is backed by science. And if the science isn't there yet, I'm going to be pretty cautious about kind of who I lead down that path. And I may experiment on myself or family members, but I'm not going to put that out there publicly just yet. But I am excited about some of the changes that are happening, and especially in dentistry, because we've been a very reactive profession for a long time, and nothing against the forefathers and greats that came along before me in the industry. And I think in the future, the dental IQ of patients is rapidly increasing with the more availability of information that's out there on the internet and the democratization of education. Patients come in, they understand some of these things better than some of their providers, and they're demanding answers. They want to understand why they're getting cavities, why is this leading to other health conditions, and darn it, you better have some answers. And if not, you better continue to educate yourself because patients are demanding better health care, quite frankly.
Well, let's get into this space now and let's elucidate in as much detail as you want to get into, how the oral biome and the health of the oral biome affects our systemic health.
So yeah, there are a lot of links out there. I think you can look at diabetes, Alzheimer's disease, cardiovascular disease, rheumatoid arthritis. And I was just looking at a study the other day looking at how there's filamentous segmented bacteria in the gut that could potentially be leading to higher osteoclastic activity in your mouth. And now just to review for the listeners, the osteoclasts, those are the molecules that break down bone. Osteoblasts are the molecules that build bone. So if you've got a heightened osteoclastic set of activity happening in your mouth around the alveolar housing of the teeth, that's potentially contributing to bone loss, potentially contributing to periodontal disease. And it's really pretty miraculous how some of these authors are able to find these connections. And again, correlation does not equal causation. I want to be
Right.
clear about that. And a lot of the authors of these studies are clear to point that out, that more studies need to be done. But it is an interesting correlational study, just looking at interplay of oral health and overall body health.
Well, what is the mechanism, the pathway that the oral biome has? Is it an inflammatory pathway? Are we talking about um, increased toxins in the body if the mouth isn't healthy? What is the pathway that we can sort of link the mouth to diabetes?
So looking at diabetes, you're having an increased elevated level of glucose in the blood. And some of the ways that manifests in oral health is looking at the saliva. Saliva is very protective against decay, very protective against cavities or caries, as it's called in the dental community. And so when you're someone who's taking several medications, you're xerostomic, meaning you have dry mouth. A lot of the medications, unfortunately, the side effect is dry mouth. you're at a heightened risk for decay and recurrent caries. And also with diabetes, you've got glucose elevated in your saliva. And unfortunately, that's a double-edged sword for promoting a cavity-causing environment when you've got excess glucose floating around your saliva.
So, okay, so you've got excess glucose in the saliva, but if you have dry mouth, that would sort of take away that problem. It's kind of a...
That's true. That's true. I was talking about two different mechanisms here. So
Okay.
if you're someone who has diabetes, yes, you don't necessarily have dry mouth, but if you have diabetes, you've got elevated glucose circulating in your saliva.
Okay.
For a different topic, for another set of patients that have dry mouth because of its a side effect for many medications, you're at a higher risk for decay. So that's a good point. Yeah, two different mechanisms I was talking about there.
And within the saliva, or within the oral biome, we'll keep it to a broader sense, we also have digestive enzymes, correct?
Yes.
And those digestive enzymes, are they linked to the oral biome? Are they linked to the salivatory glands, or both?
So digestion does start in the mouth. When you're looking at salivary amylase starting to break down carbohydrates in the mouth, digestion begins in the mouth. And when you're looking at that process occurring, you want to be careful of your intake of fermentable carbohydrates. If you're talking about decay and trying to do everything you can to lead to great oral health, fermentable carbohydrates are the building blocks for decay. Pretty much everything you ingest is going to be breaking down into fats, proteins, and carbohydrates. And if your oral hygiene is not great and you're leaving that residue on your teeth, fermentable carbohydrates are what the bacteria, such as strep mutans, that's their fuel. When they break down the fermentable carbohydrates into the acids leads to an environment that promotes decay.
When we're talking about the oral biome, the gut health biome in general, I think it is well regarded now that we have microbiome all over our body. The focus has been on gut health. I read a study that almost 70% of the bacteria in the mouth seeds the gut. Is that true?
I've seen similar studies, and just from a global view, it's kind of interesting that unfortunately, still in medicine, we have this divide between body health and oral health, as if they're in two different organisms. And as human beings, yes, we have bodies, we have mouths, they are connected. And so it is kind of funny that there's still this divide, and maybe it goes back to just the way the educational institutions are divided into a separate dental school and a separate medical school in this country. I know in other countries that's not the case, and it's probably a more integrative and holistic approach. But be it as it may, it's kind of what we have in the U.S. But I think, yeah, when you're looking at the overall oral health, there are a lot of factors that you can do to promote a healthy environment. And a lot of it goes back to nutrition, trying to make sure that you're minimizing your exposure to sugars, acids, keeping the residue off the teeth.
Now, so within your practice, are you still kind of the standard see the dentist twice a year? That's when you get your cleaning, or do you profess another way of starting a dental hygiene routine?
So I'm not beholden to the insurance companies. I'm an out-of-network provider,
okay.
and I applaud them for reimbursing and paying my colleagues as much as they do. But my treatment plans are dictated by the needs of the patient, and if a patient needs to see us more frequently, we absolutely encourage that. And a lot of the twice yearly visits kind of goes back to what the insurance companies would pay for, and that's kind of been ingrained in the general population. Oh, I'm supposed to see the dentist twice a year because that's what the insurance company will pay for. Well, you know what? 40% of Americans have some form of periodontal disease, and if your gums bleed, that's not a sign of health. That's not ideal. You need to be seeing your dentist probably 3 or 4 times a year to really make sure you're getting the professional treatments and advanced cleanings you need to remove debris, remove tartar and bacteria. And one of the things that you spoke about previously, one of the links between oral health and I guess overall body health would be inflammation. Mm-hmm. And one of the things that causes inflammation are these nodules of plaque, tartar, calculus on the teeth. The body's reaction is to create inflamed gums that turn from a healthy salmon pink more to a dark beet red. They bleed easily, and eventually the body reacts by receding the bone. That bone loss is irreversible. And unfortunately, it does not cause pain. So there are so many people out there suffering from periodontal disease, and they don't even know it because they think the bleeding's normal. So they stop flossing. Why floss if my gums keep bleeding? And there's no pain. And 20, 30 years of that happening, eventually the teeth get loose, and you're going to be looking at a life with dentures, unfortunately.
Mm-hmm. I'm curious to hear your connection, if you find there's any, between the way we breathe and the health of the mouth.
So that's a great point. And as humans, we're actually designed to be breathing through our nose. And I don't know if there's really ever been training in school for how humans breathe. We kind of just do it naturally. And some of us end up breathing through our mouth due to nasal blockage problems, deviated septums, any other ear, nose, throat conditions that may be inhibiting us from breathing fully through our nose. But the nose is perfectly designed to intake the oxygen. It warms, it humidifies the air, filters out debris. You keep all the debris out of your mouth and throat. Also, when you're looking at nasal breathing, another feature and beneficial side effect that occurs, because your mouth is closed, your tongue is up in the palatal vault of your upper jaw. That slight pressure helps guide the teeth in the proper placement. It helps expand the arch slightly in growing young adolescent individuals. So you get a beautiful, fully formed palate. And you look at the incidence of orthodontia and the need for corrective braces and orthodontic treatment, several of those individuals can be linked to mouth breathing, because when your mouth is open, the tongue is not up in the palate. So you're getting this constrictive forces from the buccinator muscles or the lip and cheek muscles, kind of gently pushing the teeth in, constricting the growth of the palate. So I do not treat children, but I do talk to parents about the importance of trying to encourage nasal breathing in young growing individuals.
Does that also impact for kids? Does that also impact the jawline, how the face actually grows?
It could. I mean, the upper jaw and lower jaw grow in tandem, and so if you're restricting the upper jaw, there definitely could be some implications on how your lower jaw is developing as well. And one of the other side effects of, unfortunately, breathing through your mouth, which we're not designed to do, when you mouth breathe, you're inadvertently drying your mouth out, again, leading to a situation where you're becoming low in saliva. And again, we know saliva is very protective against decay. So when you're mouth breathing, your mouth dries out. Sometimes this happens to people when they're sleeping. They breathe through their mouth because their nose is blocked, or they have some form of sleep apnea. You're creating a condition where decay can occur. And unfortunately, it's just not a great thing for overall oral health. So try and encourage people to nasal breathe.
Mm-hmm. So to that end, we talk about dry mouth, and a lot of people wake up, a lot of people who have opened their mouth, or mouth is open while they're sleeping, and they have bad breath. Now, is bad breath just the dryness of the mouth, or what causes halitosis?
So there are several factors that could be linking bad breath to an individual, and you could have a condition of tonsil stones. So tonsil stones are kind of these little calcified objects kind of in the back of the mouth, kind of towards the tonsils, like the lymphatic tissues, and they do not smell great. And if you're someone that's producing those stones, sometimes you kind of cough up these little white nodules, and that could be a tonsil stone. They do not smell pleasant. You might want to see your ENT physician regarding that condition.
Is that, sorry, but before you go any further, is that a genetic thing, or is that something that we're doing to cause this?
It's a great point. I have not seen literature to support that. I'm not sure. So I'd have to dive further into that.
I've never heard of that. Okay, sorry, you go ahead.
Oh, no, yeah, no, good question. So tonsil stones, you've got overall just poor oral hygiene. I mean, if you're leaving decomposing organic matter in your mouth, that's not going to smell great. So just really making sure you're brushing, flossing, whatever you need to do to keep your mouth from accumulating decaying organic matter. And also tongue scraping. Look, plaque and debris accumulates not just on your teeth, but also on the soft tissue, such as your gums and your tongue as well. Tongue scraping or brushing is a great way to remove that decomposing organic matter off your tongue that could be contributing to poor breath.
I've never been to the dentist where they've actually performed tongue scraping. Is that something that you will tell? I actually have never heard my dentist tell me about tongue scraping. Is that something that you consider part of the routine on a daily basis?
Absolutely. Yeah, I think overall good oral hygiene. You want to be removing decaying organic matter from all over your mouth, including the teeth, soft tissues. So I scrape the tongue, and it's a great way to just get rid of excess debris.
Okay. A lot of people, they wake up in the morning, their breath doesn't taste great, doesn't smell great, and they use a mouthwash. I think a lot of people understand that they shouldn't. I don't know if a lot of people understand why it's not recommended by dentists to use a mouthwash. So maybe you could explain that to us.
Sure. So you make a good point. And look, I applaud my brothers and sisters that have come before me in the oral hygiene space and trying to bring products to market, and some of the major brand players that are out there that control 90% of the space with the oral rinses. Look, there was a philosophy back in the day, kind of like the overuse of antibiotics, where sterility is good, like kill everything at all costs. Antibiotics all the time. Same with mouth rinses. Use a high percentage of alcohol, just create a sterile environment. Unfortunately, or fortunately now we're realizing that having alcohol in your mouth rinse is not great. Alcohol leads to excessive drying of the oral tissues. Just scorched earth policy of killing everything in the mouth is I think the science is getting a touch clearer on that. Can really disrupt the balance and the normal homeostasis that exists between the naturally occurring bacteria in your mouth. And that's also why here at RiseWell, we've created a mouth rinse that does not have alcohol. We use xylitol, which cannot be fermented by the bacteria to produce the acids that leads to decay. And also looking at the pH scale. There's a theory of thought that on the Stevens curve, looking at the formation of decay using the pH, when pH dips below 5.5, meaning your mouth is acidic, that's when the decay or demineralizing process occurs on the teeth. So if you are able to gently increase the pH with a more neutral or slightly basic rinse, you can elevate the pH away from the dangerous acidic zone into a more neutral to basic zone, preventing that demineralization process from occurring.
That's interesting. So we talked about that. Now, I actually kind of thought, I don't know why I thought this, that within mouthwashes, there may be fluoride as well. That's not the case?
There can be. There's certainly.
Okay.
If you're someone who chooses to use fluoride, you can definitely fluoride mouth rinses. That's not the direction we go in, but it's certainly one option for people that want to use that modality.
Now, do you use fluoride in your practice? Some dentists are moving away from. When I was a kid, I used to get little mouth trays with fluoride in it, and they'd sit our teeth for, I don't know, 5 minutes. Is this something you still use, or is it kind of, as you talked before, the science has moved on from it?
Well, I think science continues to evolve, and look, I'm not dogmatic. Fluoride works. It's been around for a long time, and back in the day, that's one of the only modalities we had to make teeth more resistant against decay. And yes, it works, but I think there's a body of evidence suggesting that such a highly reactive electronegative molecule like fluoride has some deleterious consequences throughout the body. It's not something your body inherently needs to function. There are definitely conditions and situations where you do not want to be taking it systemically. If you choose to use it, just use it topically on the teeth. You don't need to have it in your drinking water. You don't need to have it in supplements that you take. There are conditions of bony fluorosis or fluorosis of the teeth, where excess fluoride, when the teeth are being formed, can produce those unsightly and unattractive brown and mottled spots. There are indications where it could potentially be reacting in the pituitary gland and leading to different hypothyroid conditions. So we just like metal fillings work, but most people in today's day and age want white fillings. And so, here at RiseWell, we've chosen to use hydroxyapatite. It's naturally occurring, biomimetic, biocompatible, non-inflammatory, non-toxic, has a lot of wonderful properties to remineralize incipient lesions without the deleterious, potentially complicated properties that fluoride has.
Interesting. Now, just before we end the first half here, you touched on amalgams. Many people my age, 40 and up even, still have the amalgams. Are you of the mind that those should be removed, or once they're there, the damage is done, sort of thing?
Well, I think some of the research I've seen is that the amalgam removal process, or the most dangerous state of the amalgam, are the vapors. So when they're solubilized or vaporized during the removal process, if you choose to go in that direction, you want to make sure that the office is using high vacuum suction, getting those vapors away from you so you don't inhale them. I think some of this science is a little murky. I don't know if I don't really come down firm on, yes, you have to get them removed. Look, if they're in good shape, if they're not falling apart, I actually just leave them in my patients. If a patient comes in and wants them removed for aesthetic reasons, I'm happy to do that. But if they're intact, they're not falling apart, I have been leaving them in my patients.
Fair enough. Okay, let's take a break here. When we come back, everybody, we're going to talk about developing a dental routine right from childhood on up. Dr. Gatta has wonderful products, and he's going to explain to us the value of essential oils. He's mentioned some of the other ingredients in his product. So stay tuned with us. We'll be back in just a few minutes.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Kathy Biasi.
Welcome back to the Health Hub. Dr. Gatta, let's start from the foundational basis of developing a healthy oral routine. What do you tell new parents? And then how do you tell them to develop a solid, healthy oral routine?
Great question. And again, I do not treat children, but for expectant mothers and people with growing families in my practice, I let them know that, look, as soon as your child starts developing teeth around age 6 months, they need to be kept clean. We need to keep the debris off the teeth. And also, I encourage patients to bring their children into the dentist as soon as possible. I mean, usually by around age 1, let them start developing good dental habits. One of the biggest problems is dental fear, dental phobias, and a lot of that happens is because when children go to the dentist for the first time, little Johnny's got 5 cavities. He's 2 years old. He doesn't know what the heck's going on. It's very traumatic, induces a lot of fear in that child for the rest of their life if they have a negative, deleterious experience during their first go-round. And a lot of that can be prevented by keeping sugars off the teeth. Once breast milk is complete and finished, making sure they're not putting apple juice in baby bottles, trying to use water, getting sugars and acids away from the teeth, good oral hygiene, good nutrition, routine visits. And even if the child isn't even technically seen by the dentist, just having the child on mom or dad's lap during the exam, letting them get familiar with the surroundings, letting them know it's a non-threatening place, and just getting used to someone checking out the teeth, the tongue, the soft tissue, and building positive dental experiences from as early an age as possible.
So I've actually heard some people say that, the baby teeth are just experimental teeth, that they don't really matter. When the adult teeth are coming in, that's when we really have to hit it hard. Obviously not. But so then, when I was raising my kids, which was a while ago, we were told not to use toothpaste. Now, given at that time, most toothpaste did have fluoride, did have more chemicals in now, and now you have options and more knowledge. But is it okay to use products on children? And if so, and I know you don't treat children, but just sort of to help out parents here, at what age do you suggest starting a toothbrush versus, a finger brush, adding products to their daily routine?
Great point. And yeah, I think one of the recommendations back in the day to not use toothpaste was because fluoride was in all of the toothpastes back at that point in time. And look, we're not going to dispute the science of the efficacy of fluoride, but there are some deleterious health consequences. And all you have to do to check that out is just turn over your toothpaste packaging and looking at how it says do not use for children under age 6, call poison control if you swallow too much. I don't know about you, but I don't know how much is too much. Kids can barely control their swallowing muscles. So, under age 6, they were probably eating more of the toothpaste than just spitting it out. And so that's probably why that recommendation resonated. But when you're using hydroxyapatite, which is what your enamel is naturally made out of, it's just calcium and phosphate. We have that in our toothpaste and several other brands out there. You don't have those health consequences to deal with. So I would say as soon as you're starting to brush, whether it's finger brush or traditional pediatric brush your kid's teeth, absolutely use a remineralizing agent like a hydroxyapatite to help build that biomimetic shield around the teeth in case they're getting sugar exposure from somewhere in their diet.
Okay. Now you have said this a couple of times, and I think I should have probably backtracked a little bit ago. You've used the word remineralization and minerals. What is the impact of minerals on the health of the teeth?
Significant. And if you look at the karyology or the study of decay, when decay happens in a low pH or an acidic environment, and essentially the enamel is leaching calcium and phosphate out of the enamel shell. The crystals are losing the calcium and phosphate protective layer. That occurs through acidic environments, whether it's from acidic soft drinks, energy drinks, or the bacteria digesting, decomposing organic matter on your teeth and creating the acids that way. That's a demineralizing environment. To combat that, you want to use a remineralizing toothpaste or remineralizing mouth rinse that raises the pH, gets you out of the dangerous acidic low pH zone, and also it infuses the enamel back with the calcium and phosphate to re-strengthen the enamel shell. And also, when you're looking at the calcium, the hydroxyapatite, that is the remineralizing agent. It's calcium and phosphate. It's non-toxic, biomimetic, biocompatible, non-inflammatory, osteoconductive. It's naturally occurring. It makes up about 90% of your enamel, 70% of your bones, and it's a great substitute for fluoride to remineralize enamel by filling in the little chips in the armor from weakened incipient decay spots.
Okay, so my light bulb went off. I have been, under the impression that you really can't rebuild enamel. You really can't rebuild the gums. What part of that is true or not true at all?
So you make a good point. I'll start with the gums first. Let me just get some definitions out there. So gingivitis, that's reversible. It's just inflamed gum tissue. Healthy gums should be salmon pink. Inflamed, irritated gums are usually dark red. They bleed easily, but it's reversible. That's just gingivitis. Now, once the gingivitis extends for a long period of time, it can proceed and turn into periodontitis. Periodontitis is irreversible. That includes bone loss. Excuse me, you cannot rebuild that bone loss very easily. Once it's gone, it's pretty much gone. The name of the game at that point is just to prevent future bone loss. Now, switching back to the teeth and karyology and the study of decay, you make a good point. If the decay is so significant that you already have a hole in your tooth and the decay has progressed beyond the enamel, yes, at that point you need a composite bonding restoration or filling or whatever folks want to call it. And hopefully that decay has not progressed to the nerve, because at that point you would need root canal therapy where the infected material has invaded the nerve and blood supply of the center core of the tooth. Now, if you can catch the decay early enough, it's just called incipient decay. An incipient lesion is just a slight demineralization in the outer shell of the tooth. That's the enamel. The enamel layer can be recharged with hydroxyapatite, which is a calcium and phosphate. Think of a block of Swiss cheese. If the holes are just in the outer layer, you can remineralize that block of cheese with more cheese, which is just the calcium and phosphate. And by the way, cheese is a great snack because it does have calcium. So it's a non-cavity producing snack for all the parents out there. So yeah, that's kind of how that process works.
Now, what about rebuilding gums? Can adding minerals to, with your products, receding gum lines is mainly what I'm getting at here. Receding gum lines or people that brush their teeth aggressively and the gums have been pushed up. Can you rebuild the gums?
Not without surgery. Yeah, if it bothers you for the aesthetic appearance of the receding gum lines, you want to talk to a periodontist, and they can do some gum grafting or gum lift procedures. As far as preventing it from happening in the first place, I tell my patients, pretend you're brushing a ripe tomato and you do not want to puncture the skin. That's all the force you need to remove plaque and not potentially induce recession. So it all goes back to light force. That's why I recommend electric brushing. Electric brushing nowadays, they have the sensors where if you're putting too much force, it turns red. If you're have an appropriate amount of force, you have a green light that's on. And look, I get it. Driven, successful type A people, they're like, yeah, brush harder. I'm doing a better job. And like, yeah, you got the plaque off, but you also got your brushing your gingiva away. So always use a super soft brush head. It may feel bizarre at first if you're used to a medium or a more stiff bristle, but the recommendation is to use a soft bristled brush on a sensitive setting. And that really is all the force you need to remove plaque and not potentially cause recession.
Fair enough. Let's talk about your products. Along the lines of, maybe you can introduce your products to us as you talk about what we should be looking for when we're building our routine morning and night.
So you make a great point. So my sister and brother-in-law and I started RiseWell several years ago, and all the ingredients are certified clean by the Environmental Working Group. And some of the things you want to watch out for in other companies that are out there, I applaud people for trying to help raise the level of oral hygiene in the population. But some of the other companies out there, they're still using sodium lauryl sulfate. Sodium lauryl sulfate, or SLS, it's a detergent. It is not needed in your mouth. Your mouth is a very highly absorbent region. You don't need this detergent in your mouth. It is the ingredient used by the big box companies to create the bubbles, the foaming, and the suds. And there was a thought process, probably by marketing, that look, it's creating these effervescent bubbles and suds. It must be working better. Well, that's not necessarily the case. There's been studies linking sodium lauryl sulfate, which can inhibit fibroblasts. Fibroblasts are very important in healing. And so if you just had an extraction or any kind of mouth surgery, you don't want to be introducing SLS into your mouth, which inhibits or stops fibroblasts from doing their job, which is promoting collagen and the healing process. Also, sodium lauryl sulfate has been linked to aphthous ulcers and those little annoying mouth sores that you can get. So if you are prone to getting those mouth sores, sodium lauryl sulfate can irritate and delay the healing of that. Now, looking at our routine, I recommend floss. Floss is critically important to get between the teeth. A lot of incipient lesions are happening between the teeth. Starting with flossing, that loosens up all the organic matter and debris. I next recommend a mouth rinse. And our mouth rinse is pH balanced. It has xylitol, which is protective against decay. It slightly raises the pH out of the acidic zone into a more neutral, slightly basic zone where decay cannot occur. After that, I recommend brushing with a hydroxyapatite-based toothpaste to help repair any incipient lesions by remineralizing. And it also is incredibly helpful with sensitivity. It's actually a side benefit we did not even realize we were kind of stumbling onto. But I've got areas of recession in my mouth, and they were extremely sensitive. The hydroxyapatite nano-sized particles are very good at working their way into the odontoblastic tubules to help block sensitivity, which annoys many citizens out there.
Mm-hmm. Is that the order too? Floss, rinse, brush?
It's my recommendation. Sure is.
Twice a day? Each?
At least, yeah.
Okay, fair enough. Now, I know that a lot of the toothpaste out there, along with, the cleansing and everything, promote whitening. This is a very gray area for me. We talk when you investigate about whitening, some can be very dangerous, some can remove the enamel from the teeth. What is your perception? Do your products improve whitening? What is your idea about whitening, and how can we promote better coloration? I mean, I know that the teeth aren't supposed to be glistening white. So maybe you can give us some guidance along this very popular topic.
Absolutely. Hey, who doesn't want a beautiful white smile?
Right.
It's such a marker of just health and vitality in youth, and it leads to so many opportunities in business, relationships, just friendships. Who doesn't want to be around to have a beautiful white smile?
Mm-hmm.
So first, let's talk about staining. There are several different types of staining. There's extrinsic staining, which is on the outer layers of the tooth, and that can be just from coffee, tea, red wine, smoking, all the fun stuff that people engage in. Also, there are intrinsic stains. Intrinsic stains can occur congenitally. such as if your mother was taking tetracycline during pregnancy. Unfortunately, that antibiotic has been linked to causing these dark bands during the crystallization process of teeth in utero, which can be very tricky to remove. Our products are great at helping to lessen the appearance of extrinsic staining. So the light staining that occurs through normal wear and tear, certainly. Some of the silica and little gentle cleansing particles we have in our pastes are good at helping with that. If you're looking at more deep bleaching, you're going to be looking at a chemical agent. And I know everyone wants to try to find a natural DIY remedy for everything, but unfortunately for getting extrinsic stains out, chemical bleaching is still one of the most effective ways to do that. And some of the agents to do that are hydrogen peroxide and carbamine peroxide. And those molecules just use free oxygen to help blast away the pigmented color particles in the teeth. And you can do that in office. They give you a higher concentration in the dental office, or the take-home trays are a popular agent as well. It will bleach your gums, so you want to be careful of kind of taking it and swiping it off your gums if you're doing the trays at home. Just keep it on the enamel. I have not seen links to damaging effects of this, but if you're looking for a brighter, more radiant smile, bleaching is the option to do it.
Okay, and what about oil pulling? Does that have benefits, for whitening and beyond?
Yeah, so I mean, look, I'm kind of agnostic to oil pulling. I don't encourage or discourage it. If people want to do it, absolutely. I mean, essentially, when you're looking at getting the kind of the theory is matching up the bacterial cell membranes in your mouth and finding a similar lipid solubility of your mouth rinse. So the essential oils in mouth rinses, when you swish, you can combine, and they have similar hydrophobicities. They link up, and the oil pulls the bacteria into the solution because of the likeness of the bacterial cell membrane. And so when you rinse for several minutes, and then make sure you're not swallowing that mixture, but you're spitting it out, the theory is that oil pulling will pull the bacterial cell membranes and harmful products out of your mouth and spit it safely away, and just getting rid of pathogenic material that way.
It can do no harm, though.
Not that I've seen.
Okay. And actually, you brought up something that I was remiss from asking you about. What type of essential oils and why do you use essential oils in your products?
So essential oils, there are compounds in there with the phenols and aldehydes that have shown to have anti-pathogenic properties. And we want to help promote a healthy mouth and get rid of diseased organisms. But we don't want to take a shotgun, scorched earth approach of a high alcohol content like the big box companies out there that kill everything and leave a sterile environment. I think the research is showing that that's not the approach that you want. We want to maintain the mouth's healthy homeostatic balance, and the essential oils are there to help with neutralizing some of the pathogenic bacteria in the mouth. And we use the citrus essential oils. And also for people that have concerns over essential oils, we offer a flavor-free toothpaste. There are not many on the market, but there are no tastes, no flavors, no dyes, no anything in that one. It's just the remineralizing scrubbing agent, and that has none of the oils for people that are looking for an even more flavor-free experience.
Fair. Now, our show takes place in Canada. Do you have distribution in any place other than the United States? Are we able to get your products here?
We do. We do have distribution throughout Canada. We have some partners online, and I can get those in the show notes to you, but we do distribute through Canada.
Wonderful. Can you give us ways that people can follow you to look at your products, see what you're all about?
Absolutely. We're active on the social media channels, RiseWell Co. For Instagram, Dr. Derek Gatta at my channel, and my practice, Innovative Dental Aesthetics, here in Boca Raton, Florida. But social media is probably the best way to catch us. And also through our website, risewell.com, we have an active blog sharing health tips and techniques to keep you and your family feeling healthy and looking your best.
Wonderful. Thank you so much for joining us today. I think you've really given us lots to think about and reconsider when it comes to our oral health.
My pleasure. Thank you for having me and holding space during this time.
Thank you. And everybody, we will talk to you next week on the Health Hub.
You have been listening to The Health Hub, hosted by Kathy Biasi, here on